As a scoliosis specialist and Schroth therapist, it's important for me to teach my patients how to move safely and efficiently. As a certified personal trainer and Polestar Pilates educator, I want them to begin a mindful exercise program as soon as possible. Over the next few weeks, I will be providing 10 tips for how to exercise when you have scoliosis as an adult. The first tip is know your curve pattern. This will help you determine corrective postural alignment for exercise and understand risk factors associated with curve patterns. Whether you have one or two curves, your curve pattern is determined by where the curve apex is, whether the pelvis is shifted, and the direction of the shift. Let's examine two of the most prevalent curve types. In a thoracic primary curve, the pelvis is coupled with the lumbar spine, and together they shift opposite of the thoracic curve. In a lumbar or thoracolumbar primary curve, the pelvis is uncoupled from the lumbar spine, and they shift in opposite directions from each other. If you have a balanced spine where there is no pelvic shift, then more examination is required to determine primary curve. The goal is to improve postural alignment by expanding diagonally up and out from the curve apex to decompress the concave side. This diagonal expansion incorporates a three-dimensional decompression and will be incorporated into your exercises. Did you acquire scoliosis as an adult? This is known as adult onset scoliosis and is brought on by unilateral degenerative changes in the lumbar spine. These are mostly single lumbar curves, and we'll discuss the increased risk in having a degenerative scoliosis or a single lumbar or thoracolumbar curve pattern in a later tip. So understanding your curve pattern helps you going forward in your selection of your exercises and the positioning of your exercises. Stay tuned for tip number 2. Thank you.